Good evening and welcome to one and all. And we want to say a hearty good evening and welcome to another fabulous and informative session of Spotlight Endometriosis hosted by the Trinidad and Tobago Endometriosis Association. We thank you one and all for joining us and for being a part of what it is we're going to be engaged in this evening. As we say welcome, we want to welcome all of you, as we said, who've taken the time to log on this evening, because without you, we would not be able to host these sessions. We want to also say welcome to our guest speaker, Ms. Sant, and you're going to hear more about her and more from her as we go into this evening's proceedings. I also want to take the time to say welcome on behalf of the founder of the Trinidad and Tobago Endometriosis Association, Ms. Brigid Winter, as well as all of the members of the board and the executive who are here with us this evening. So once again, welcome all. Now, as we go into our session, and again, we've been having these monthly sessions highlighting endometriosis and how we cope with it, how we live with it, ways in which we can manage, because what we are talking about really is management, and there's so many different aspects of endometriosis that impacts our lives. And in particular, we have been focusing on endometriosis and mental health. And in today's session, we're going to get into that in some more detail. And I want to remind us that even as we get into this, we want to remind you on behalf of the TTEA, and this is our disclaimer, that as we get into our sessions, that the information shared on this program is for general, informational, and educational purposes only. It does not constitute professional medical advice, diagnosis, or treatment for individuals. Please consult your healthcare provider if you have questions about your health or before starting any treatment. And this is our disclaimer that we will constantly be reminding you of. This is just support, advice, but please remember, you need to seek the professional advice from your healthcare provider. So we want to go into our presentation. And I want to introduce to you our featured speaker, Miss Kimberly Sant. And Miss Sant is currently pursuing her MSc in Counselling Psychology at the University of the West Indies in Cave Hill. Her areas of expertise and research include the link between mental illness and chronic illnesses, anxiety, depression, and cognitive behavioral therapy. Ms. Sant also tutors short courses in child and youth counseling, child psychology, and play therapy. She is also actively involved in volunteer work mentoring children, as well as mentorship work with the UNHCR doing community outreach for Venezuelan refugees. Ladies and any of our gentlemen who've logged on this evening, I introduce and welcome our featured speaker, Ms. Kimberly Sant.
Thank you so much for that introduction. I really do appreciate the opportunity to be here and to speak to you all, and I do hope that what I share with you all today could help somebody in some way, and it really would resonate with you all, and hopefully you all can identify with some of the things we would talk about today. So I'm just going to start to share my screen and we can begin the presentation. Okay, so today the topic I will be talking about will be mental health challenges faced by endometriosis patients and how quality of life is affected by it. Because as research continues, we really have begun to understand the connection between our physical and our mental health a bit more. And so that's why I thought it was fitting to talk about this topic also today. And hopefully, if anybody viewing has experienced these things, at the end of the session today, they could share that a little bit with us. just so we have a better understanding of it as well in context. So I'm going to start now. Okay. So today we're going to just briefly talk about what endometriosis is. Of course, a lot of you here would already have an understanding of it, but just to kind of make sure we are all on the same page, we're going to talk about it a little bit. Then the two main concerns we're going to focus on today would be depression and anxiety, because these would be the things that are most common among endometriosis patients. We're also going to talk a little bit some of the ways you could cope with these things in the context of having endometriosis. Okay, so firstly, what is endometriosis? It is a common gynecological condition that affects many women of childbearing age. And of course, it is something that is quite hard to get a diagnosis of. So a lot of people may not know that they have it, and they may just be silently suffering to some extent. Women with endometriosis, they develop tissue that looks and acts like endometrial tissue outside the typically on reproductive organs inside the pelvis or the abdominal cavity. And each month, it kind of behaves like endometrial tissue, and it would shed itself, which could be quite painful, of course. And that pain really brings a lot, or brings about some of the mental health concerns that we are going to talk about a little bit today. So in the context of mental health, these mental health conditions, they include a variety of disorders. Today we will talk mainly about depression and anxiety, and these disorders would affect the way a person thinks or behaves. These conditions could also have an impact on a person's mood, and many people throughout the world experience mental health challenges, and these could be experienced throughout any point in your life in response to traumatic events or in response to a personal struggle, which is kind of what we're going to focus on today, which would be the struggle or the experience of having endometriosis and how these challenges, these mental health challenges, kind of interact with it. So the first thing, endometriosis and mental health. Endometriosis and its related symptoms, one of the symptoms mainly would be the chronic pain, the chronic pelvic pain, and the experiences that this brings with it could lead to impaired mental health and a decreased quality of life. And this association has been seen more in women who lack an understanding partner or support system, whether it be husband, friends, parents, in the case of younger people, and in those who experience chronic and severe symptoms, which would be like what I talked about with the pain and all that. However, any woman with endometriosis, regardless of her personal situation or symptoms, may be at risk for developing mental health conditions such as anxiety and depression. So in this chart, we see the interaction of mental health and endometriosis. So if we start with this first box, which will be this first circle, which would be before, during, and after diagnosis, in terms of trying to get a diagnosis, and you're kind of unsure of why you're feeling this way, and even those around you may think, you're kind of faking it, or they may think you're just over-exaggerating. Then during the time of your diagnosis, you could experience these struggles because you have to now understand your body and get to understand why you're feeling these ways and kind of even accept that. And then after your diagnosis, which would be now going into another part where you start to live with this diagnosis, one, and two, with kind of the effects of it and all that. So this would lead, you have these different symptoms that you're experiencing. Here I just gave an examples of some of the symptoms. So it can be different things: pain during sex, infertility, chronic pelvic pain, among others, which could lead to a negative sense of female identity, As you know, we know that, especially for something like fertility, is something that is very important to women, especially in the Caribbean. You kind of pride yourself on having kids and all that. Even in terms of being a good sexual partner, it is something that we try to maintain, and this could really affect then our self-esteem and our self-perception. So how we see ourselves, how we feel about ourselves, and this would then lead to mental health issues. And some of the feelings we're going to talk about today, which would be feelings of anxiety or feelings of depression. So in terms of depression, depression is a very broad term. It's very used a lot, overused to some extent. So just to give a kind of understanding of what I mean when I say depression, a lot of people will experience symptoms of depression for a day or for a couple hours and say, oh, I'm so depressed. But really, the feelings of depression, the feelings of being sad or just feeling hopeless, extreme fatigue and those things, they form a mental health diagnosis. Typically, people with endometriosis who are depressed, they could receive one of two diagnoses in terms of depression, and these would be major depressive disorder, which is where we see the symptoms of depression persisting constantly, being there constantly for a period of 2 weeks. So the symptoms, obviously, when you go to whoever your healthcare provider is, they would do your relevant screenings and stuff like that. And if they do find you are depressed, you would be initially given a diagnosis of major depressive disorder because, first of all, they would look at depression in terms of a 2 week time period. And then they would look at it, because obviously endometriosis is going to be something you have to live with. So then the next step would be to look at it in a 2 year time period, after which you would be diagnosed with persistent depressive disorder, should the symptoms continue accordingly. So some of these feelings will just be general feelings of being downtrodden or feelings of being sad for an extended period of time, and these feelings tend not to go away. Another thing that is important to note is that sometimes, not sometimes, with depression, others around you should be able to notice your change in mood and your change in behavior. And feelings of depression can really impact someone's desire to take part in certain activities that they would have once enjoyed. And like I would have said a little bit before with the interaction, it could also negatively affect your self-esteem and your self-worth. And if these depressive symptoms aren't controlled or they aren't, or you don't attend to them in a timely fashion, they could get so intense that they cause suicidal thoughts or behaviors even, which is really at a point you try not to get to. So now in terms of depression and endometriosis, endometriosis patients go through certain things that are somewhat unique to them that would cause depression. These could be things like the daily stress of dealing with your symptoms of pain, inflammation, your abdominal stress, fatigue, and you're generally feeling unwell. And you really just don't want to have to get up and deal with things, go to work, deal with kids. You just kind of don't want to have to do that. And you just end up in a place kind of unintentionally, and you end up in this depressive state. Another thing that suffering with endometriosis, especially for a prolonged period of time, you kind of have that constant worry at the back of your head, mostly, but sometimes it does come to the forefront, especially, in challenging times, about the financial implications of kind of treating this disease. I mean, we are lucky in Trinidad to have free healthcare, but I mean, not everything we could go to health centers and all that for. Bills do mount up, and it does cause us to feel sad, to feel upset, to get these feelings of depression. And then also has an impact on our relationships in terms of our friendships or even with our extended family. You know, sometimes we just kind of going through something, we feel so unwell, we feel so sick. We really don't want to go to events, we don't want to have to interact with people, it's not just a time of the month anymore, it's always kind of every day you battle in this. So you really just kind of want to be in your own space, and that could really initially, you want to be in your own space, and then you're so much in your own space, you start to feel isolated from everyone else, and you may even feel like your friends and family hate you. But really, you need your time to work through how you are feeling and try and kind of come out of that space. And another thing, obviously, I would have talked about it a little bit. Endometriosis is so complicated in terms of understanding what the person who has it is going through. That those around us, whether it be family, friends, co-workers, they just wouldn't understand. And they may think we are overreacting or just blowing things out of proportion, and they tend to be insensitive, sorry, and they tend to make rude comments and stuff like that. And for us, that kind of just pushes us away a little bit, because why would we want to be around people like that, really? Then we also have the added stress on our personal relationships, which would be mostly with our romantic partners, whether it be husbands, boyfriends, whatnot, because, the impact of endometriosis, one of the things that goes along with it would be painful sex, even the infertility would go in here. People may not want to stick around for that. So it could lead to the breakdown of relationships or ended marriages. And then specifically to infertility, this would weigh heavily on people who have been diagnosed at a young age. Because obviously as a teenager, you're not really thinking too much about having children, but then you get this diagnosis and you're not really going to be sure until or for a few years. So there's always that at the back of your mind, can I have kids? How will that look like for me? And then even as someone trying to get pregnant, you don't know if, or you just struggling constantly to get pregnant and to kind of stay pregnant in some cases. And this could cause a lot of anxiety as well and stress. And then this could also affect our relationship with our partner, whoever that may be, and even affect any other family we have, in terms of if we have other children, or if we live, or our parents or something like that, they may put that stress on us to kind of have kids as we get older and stuff like that. Okay, so now we're going to talk a little about anxiety. And anxiety is really a feeling of uneasiness or nervousness or apprehension. And it often occurs when we are confronted with things that are unexpected or uncomfortable. Some worrying is common, or is normal, sorry, because it keeps us in check. Things like being late, we kind of worry and we have a little bit of anxiousness if we have to be somewhere on time. That's normal. It keeps us in check. But when it keeps going on and it starts to affect our daily lives is when it can be a problem. And another thing that has become really an area of research is the thought that the connection between our minds and bodies can help us regulate our feelings of anxiety. And this mind-body connection really goes back to the brain and the limbic system. This is the part of the brain that controls our emotions. So basically, just to give a overview of that, there would be 4 parts of the limbic system that help in emotional regulation. These would be the hypothalamus, the hippocampus, the amygdala, and the thalamus. The hypothalamus really controls our flight and fight mechanisms, which would be kind of related to anxiety, because you have these feelings of anxiety and when feelings of anxiety come about, you start to feel, well, you start to feel anxious, you start to have racing thoughts, you may start to feel your heartbeat increases, you feel like you just want to get out of that situation. So that's when the hypothalamus and the fight or flight mechanisms are activated. Then we have the amygdala, which is said to control anxiety a little bit more because this is kind of the center of our aggression. And in terms of that, when the amygdala is stimulated, it is really when we see a lot of anxiety occurring, and the amygdala also corresponds to feelings of depression because this, these feelings will affect our sleep, they'll like affect our behavior, our moods and stuff like that. Then we have the hippocampus, and this is where we take our short-term memories and we turn them into long-term memories. So what we tend to see with anxiety is and even with depression, if we have these short-term memories being turned into long-term memories, but these short-term memories could be something traumatic, or, even in the case of endometriosis, when we have, let's just say we have a flare-up or something like that, and you are thinking about these things, and eventually these short-term memories of how you experience that flare-up go into your long-term memory, and your hippocampus is, yeah, somebody had a question. Okay, and your hippocampus is activated. That's when you would kind of have those feelings of anxiety because, you don't want to have that flare up or have those physical feelings associated with your flare up again. And then we have, okay, sorry, that was the end of that. Okay, so, and in terms of the mind-body connection, we also going to talk about that a little bit more when we talk about some of the coping strategies or coping skills. So anxiety, it has mental symptoms such as irrational thoughts, irritability, difficulty concentrating, among other things, which can then lead to physical symptoms such as a racing heartbeat, dizziness, frequent urination. So, these mental symptoms, sometimes we're just thinking about things so much and we let these things affect us so much that it then translates into physical symptoms. Okay, so, hello. Okay. And in terms of anxiety and endometriosis, anxiety can be triggered before or during medical exams, which leads a woman to feel overwhelmed. Because sometimes, you're so thinking about what the doctor is going to say, or even you just sitting there in the exam room and you're so just waiting in anticipation that it leads you to have anxiety. And then hormonal levels can also trigger anxiety. The stress hormone, which is cortisol, it can trigger anxiety when it's released in excess because it just affects everything basically. And studies have linked low levels of estrogen to anxiety and mood disorders. And we also know that premenstrual dysmorphic disorder, form of PMS, it involves hormonal shifts, which can then also lead to anxiety and severe depression, among other things. So in terms of the ways that we could cope with anxiety and depression now, okay, so the first four, which will be yoga, meditation, mindfulness, and coloring, these really speak to the mind-body connection. Yoga, we know, it's also a form of meditation, but it does help to kind of promote physical activity and just being so in tune with ourselves and kind of calming our minds a bit helps the feelings of anxiety and depression. Meditation is the same thing, so a lot of people, they say that the traditional form of what we know meditation to be, which would be kind of just sitting in silence, it doesn't help them. So what I've started recommending to people to do is try guided meditation. There are a lot of videos on YouTube about it. There are a lot of podcasts on it. Basically, what the guided meditation is it will kind of, there's a speaker behind the video. The video is typically like scenery, different backgrounds, things like that. And there's some type of music, frequency music or something like that. But the speaker is what you hear most. And the speaker is telling you different things to think about, just to calm yourself and take your mind off of whatever is going on a little bit. And even in terms of that, the meditation, you know, you could do it sleeping, laying down, or sitting up. You know, so it's something that's very versatile, and there are a lot of videos, a lot of resources on it, and you will always find something that kind of works for you. In terms of mindfulness, it's kind of just getting to know yourself a little bit better, and know, in terms of meditation and yoga, kind of getting to know what works for you a little bit better, and just understanding yourself, understanding who you are at your core. Coloring, which is something that has kind of become popular among adults in the past few years, it kind of just helps to distract our minds, take our minds off of other things. It just helps us focus on what we're doing. Some people also say things like painting, drawing, along these lines. Those help them a lot to cope with their things. And even in terms of that, you could find new hobbies or practice hobbies that you had in the past and you really enjoyed. You know, it could be anything, just from doing some sort of physical activity or to dancing or something like that, just getting in tune with yourself a little bit more. And then taking care of your physical health in terms of exercise. I know obviously with endometriosis, there would be a lot of pain for quite a number of days of the month and stuff like that. So you may not always feel up to exercising, but you know, a simple thing such as walking, that doesn't require too much, could really help you kind of just get your body a little bit active and take your mind off of some of what's going on. And then in terms of using mood trackers or some type of journaling to help you track your symptoms, and by symptoms, I mean, if when you are having an anxious episode or even a depressive episode, if anything would have happened prior to that. So if you met somebody and they may have said something insensitive, and that kind of triggered your anxiety or triggered you to be a little bit depressed for that day or the coming week or whatever, you track those things and then you try and eliminate the things that cause the depression and anxiety and introduce more of the things that kind of help you a little bit more to be more the person you want to be, or be less depressed, less anxious. And then in terms of seeing a therapist, this would speak directly to people who may not have been or have not been officially diagnosed with any type of mental illness. And even if you just want to find somebody to talk to who could kind of relate to what's going on a little bit more, and not judge you, because obviously family and friends could sometimes be quite judgmental. But the important thing with anxiety and depression, because it's so misunderstood, especially because you would already be going through a physical illness, it would be important to get that mental diagnosis. So a therapist or a psychiatrist would do their screenings and kind of figure out what exactly you have. I mean, I know when I talked about the depression, I would have talked about major depressive disorder and how we kind of tend to diagnose it and all that. So this would be another important thing that the therapist would do, because they would really get you through the process of screening and all that, and get you, once you have an official diagnosis, even if they kind of have a suspicion, it would help you to understand yourself a little bit better and understand how to deal with what you're going through a little bit better. And even kind of having that and starting to work on yourself will help your family members understand you a little bit better and probably not be so insensitive, which then brings me to turning to family or friends for support. Because sometimes when you're going through difficult things, you don't really, you tend to think other people wouldn't understand, or you just don't want to expose yourself in that way to other people. So, really turning to your family and friends, even though really they may not understand or they may be a little bit insensitive, knowing who's there for you kind of is important when you're going through difficult times. And it really would help you get through that. So that brings me to the end of my presentation. I know we have an official Q&A, so I'm going to stop sharing now.
So thank you very much, Kimberly Sant. Thank you very, very much. And yes, we are going to go into a time of Q&A. But what we will do, we're going to take a short break and we're going to go into our question and answers. We will take a short 2-minute break, and we're encouraging you to please put your questions in the Q&A so that we will be able to flow very smoothly and very efficiently when we get back from our 2-minute break. So we'll see you guys in 2 minutes. So welcome back, ladies and gentlemen. We're continuing with our discussion on endometriosis and mental health with our Ms. Kimberly Sant, and we are about to enter into our Q&A segment. And to lead us through that session, I'd like to introduce and hand over to our ever able and competent board secretary, Ms. Brigid Winter.
Good evening, everyone. Thank you, Kimarie. And I want to also welcome all of you here this evening. Thank you, Ms. Sant, for your presentation. So I'm going to jump right in, but just before we do that, I just want to remind you that all the information shared here this evening is for general, informational, and educational purposes only. It does not constitute professional medical advice, diagnosis, or treatment for any individual. Please consult your healthcare provider if you have questions about your health or before starting any treatment. Thank you so much. And I want to encourage you to put all your questions. I'm seeing lots of questions in the chat, but if you can put them in the Q&A so we can deal with them there. Thank you. Ms. Sant, I want to start by asking, so I'm an endometriosis patient and I'm feeling sad, so I recognize that something is wrong. Who do I reach out to? Is it a psychiatrist? Is it a psychologist? Is it a counseling psychologist? So if you could just tell us like the basic differences between the three, and if there are any more, or just a therapist, what's the difference? And how do we know who to reach out to?
Yeah, definitely. So in terms of a counseling psychologist or a therapist, they are quite similar. However, you find therapists would do more interventions in terms of more activities to try to help patients. Counseling psychologists do more traditional talk therapy, so that would be more what you see on TV, lying on a couch, if that's what you're comfortable with. In that regard, well, counseling psychologists, they kind of merge with therapists now. So in terms of my own practice, yeah, my degree is counseling psychology, but I would say I'm more of a therapist. In terms of I don't just do talk, I do a lot of strategies or interventions. And then I would say ideally, though, in the first instance, you should reach out to a clinical psychologist because these would be who are trained, one, in talk therapy, two, in interventions and strategies, and three, in the diagnostic aspects, as well as assessments, because to diagnose, we have to assess, which counselors and therapists can do, yes, but clinical psychologists just do it a little bit better. So I would say reach out to them, and they would be the ones who then say if you should see a psychiatrist, because a psychiatrist is a medical doctor who then specializes in mental illness, not really mental health. But if it is your clinical psychologist finds that you do need medication, he can't or she can't prescribe that, they would have to send you to a psychiatrist. But definitely the first step would be a clinical psychologist, in my opinion.
Great, thank you. Is it possible for depression to develop into mental illness?
Okay, so depression would be a form of mental illness because it's kind of not functioning properly. The mental aspects of you is not functioning properly. But we tend to, best practice these days kind of states that we don't use the term mental illness as much. We use mental health, and we try to encourage people along that strain. So yes, you could be depressed and you have some sort of mental illness, but we try to more focus on how we get it back into being mental health, or how we get you back into being a healthy, mentally functioning individual.
Right. Thank you so much. So I'm seeing it's a statement. You said to talk to someone for support, especially with health issues, but if you need professional advice, I don't think a family could help. What do you all have in place? I think maybe she's asking about the TTEA, but what she's saying is that if she has a problem, talking to the family would not help.
Yeah, definitely. It depends on your family setup and stuff like that. So let's just say, your family can't really be of assistance. You talk to those around you. We all might have, or hopefully we all have somebody who kind of guides us in terms of, even if it's just somebody in the village or an aunt, a relative. But because sometimes we may not know where to turn, right? And there might be people around us who have a little bit better idea, or they may even know people who they could ask to help us a little bit better. But in terms of where to turn, I would say, and you really are like, just have no idea, the Trinidad and Tobago Association of Psychologists, they have a website, and on their website has a directory with all the people registered with them, and I think they have a little bio of everybody in terms of what they specialize in, and if where they are located and stuff like that. So what would be best for you? So in that regard, you could go there first, and even they may be able to direct you a little bit better in terms of what's specific to you.
Great. I think maybe one of the issues is that we still have a stigma attached to.
Yeah, definitely.
We're not even talking mental health. We're just saying depression. There's still a stigma attached to it. So even though somebody's feeling down, they don't want people to think that they are depressed. So they don't say it until maybe it gets out of hand. But is there anything we might be able to do at home? For example, I have panic attacks sometimes, but I can tell when they're coming and I can talk to myself. But there's something that we can do if we sense something happening in advance before it gets, maybe out of hand.
Definitely. So being able to kind of talk to yourself and control it, that's one of the best outcomes of a panic attack. And it's quite easy to treat in that way because you're still in control of your mind in that situation. So in terms of that, what I would have shared a little bit would be the tracking, journaling and all that, so that you know when these things are coming on, one, for future reference, and two, then based on that, so what we tend to say is we try not to let people ignore the feelings of anxiety or the feelings of depression. Obviously, in terms of a panic attack, the feelings come very strong. So, and if you're not in an ideal situation, let's say your ideal situation is being at home by yourself, in terms of being able to work through that panic attack. But let's say it comes when you are in the grocery store and, you may feel a little bit ashamed or just, concerned about what people around you may think. In terms of that, you could do something like drink some water, just stand there and take a few deep breaths. If you are at home and you could do whatever you need to do in terms of, it could be something as simple as the breathing really does tend to help. So just taking those few moments to have a few breaths, even in terms of just going outside, because sometimes people feel when they are indoors, they feel a little bit confined more and the anxiety could come on a little bit more. So just go outside and try to do that. Another thing that works for a lot of people is the grounding technique. So we tend to use our senses. So you identify 5 things you could see, 4 things you could smell, 3 things you could touch, and we just go on like that to kind of ground yourself a little bit more. So those would be some suggestions.
Okay, great. I hope we're taking notes. I just want to follow that up with someone is asking for further information on what exactly guided meditation is. Right,
yeah. Okay, so guided meditation is something that is kind of new, but it is, you could go on YouTube, or if you listen to podcasts, you just search up guided meditation. You could search up guided meditation for sleep, for anxiety, for depression, for healing, for anything. So basically it's just, regular meditation. If you listen to a meditation video, they may have some type of frequency music or something like that, or some type of background music. So they have the background music. If you're listening or if you're looking at a video, they would have certain images that tend to relax you. Most times it will be things like scenery, waterfalls, things like that, that most people find enjoyable. And then there would be somebody, like a voiceover, talking and telling you, I know you've had a difficult day. The day is coming to an end now. Let's think about some of the things that happened today that made you grateful. Just things like that to kind of, because a lot of people, especially with anxiety and depression, their thoughts tend to go in all different directions and they can't really calm themselves. So the guided meditation then kind of redirects your thoughts and it helps you just reorient yourself and even ground yourself a little bit. Yeah, so that's basically what it is. But even if, just out of curiosity, after today's video, if you all haven't heard of it, just go search it up and see if it's something, because you don't even have to be struggling with anxiety, depression, sleep issues. It's just something nice to do, a self-care activity.
Yes, I like that self-care. You don't have to need it, but
yes, exactly.
It's very calming. I've heard one before.
Yes, definitely.
So it is very calming.
Mm-hmm.
Someone is asking, how long does anxiety last for?
Yeah, so it could last for as long as it lasts. We tend to try not to put time limits on things, because what we see, especially in anxiety, if we ignore the feelings of anxiety, or like you said earlier, panic attacks, if we just distract ourselves from a panic attack, we find that the next time it comes up, it may be more intense. So we try to feel what we have to feel when it comes on. So in that way, you may not always, you may want to put a time limit on things, but understand that part of healing and part of growth even is experiencing those feelings. And obviously, when you are suffering with physical illnesses, such as endometriosis, that would be chronic, and lifelong, the feelings of anxiety or the mental health issues would arise throughout your life. It's not going to have a time limit on it. But then that's kind of where the importance of coping strategies, or even if you are going to therapy or anything like that, would come in, because you kind of learn how to deal with it a little bit more. So, I'm not sure if that person is speaking in terms of like a panic attack, or just in terms of just always being depressed. Anxious. But the hope, or in terms of using coping strategies or even going to therapy, is that you're not always going to feel the feelings of anxiety. Yes, they will be there at the back of your mind, but they wouldn't always affect you or affect your daily functioning. So yeah.
Okay, I get that. So it's kind of situation based to an extent.
Yes.
You may not always be sick.
Mm-hmm. Yeah. That's the best case, scenario in terms of it. Yeah.
Great. So we are thinking in terms of ladies who experience painful sex and have all these issues. As you said, sometimes it doesn't make us feel good about ourselves, especially we think we look less than in our partner's eyes. Do you recommend that a woman who has been diagnosed, that she discloses this information to a partner before marriage? Do you think this would ruin the relationship?
Well, I think it would have to be if you are really comfortable doing that or not. I don't think it would be a yes or no situation, in terms of what I could suggest. But I think, getting to know yourself before the marriage as an individual would kind of help you know whether or not that's the right thing for you, because it may not be the right thing for me, but it might be the right thing for you. And in terms of it, I know some people may be concerned if, their partners might not want to continue the relationship or something like that. So I would say it's important to think about, take those things into consideration. And even if it is just having a conversation with your partner in a hypothetical, and or just asking him his opinion on these things, or even just showing him a video on endometriosis and stuff like that, or sending him an article just out of the blue, just to get his opinion. And that could even cement it a little bit more for you, whether or not you should disclose that prior to marriage. I hope that answers the question. But in terms of that, I think it's very personal and very unique to every situation. So I don't want to say yes or no. I think it's whatever is best for you and whatever is best for your relationship.
Correct. You can't, this is not a straight yes or no question. Yes. Somebody has chimed in and said, if the relationship is ruined, it was not the relationship for you.
Yeah,
But
so
I
exactly
do
that's okay.
think that if you are one of those people who really have terrible symptoms every month, that it will come out at some point.
Yeah,
Yeah?
definitely. And even in terms of telling the person, they could be that source of support because, sometimes, you may not want to leave the house to get groceries, cards, things like that. So even simple things like that, even if they can't support you emotionally because they just don't understand. They're not going to understand that side, in terms of other forms of support, they could just be that form of support.
The words that you just used there, they don't understand. And I
Yeah.
think that some people also have that issue. I'm going to a therapist and I'm telling them about a situation that honestly they just cannot understand. How can this person help me?
Yeah, definitely. So, it's because you could start off going to a therapist. Like I said, you let's just say you go on the Trinidad Association of Psychologists website, you find a therapist. You go to that person, you realize this person has no idea what you're talking about. Therapy with them isn't making sense. That's fine. You communicate that to them. You tell them that, and most times they would, if they haven't recognized that before, they would be very open to giving you a referral to somebody else who could treat you better because I don't know. I know there is one sex therapist in Trinidad, but in terms of women's health and all that, there would be a few. So I would suggest those might be more appropriate to go to. But if you realize that it's just not making sense going to a specific person, that's fine. Stop going to them or just communicate that to them. And some therapists would even change the approaches they are using, or they would just send you to somebody who is a little bit more fitting to your situation.
Right.
Yeah.
Right. I do think there's more than one therapist, sex therapist in Trinidad
Yeah,
now.
I'm not too sure. Yeah.
That being said, do you think a sex therapist would be beneficial in this, because it's a medical issue, do you think a sex therapist would be beneficial in this kind of situation?
Right. Okay, so I just gave the example of the sex therapist in terms of something that was quite specific,
Right.
in terms of painful sex. But because their training wouldn't only be sex therapy, it would be therapy in general. But
Okay.
in terms of the link between the medical and mental, kind of what today's session was about then is, we have this physical thing going on with us, but because of that, it's affecting us mentally. Or we may have even had these mental symptoms before, and then physical things came up and started to kind of magnify the mental symptoms. So, it is quite important to see, obviously, your medical doctor. And I would say in conjunction with a mental health professional, especially if the symptoms of whatever type of mental health issue you are having become quite intense or affect your life in major ways. Yeah, I would say definitely it is something you should do because, the sometimes we see that people, their physical side may be getting better, but their mental side may be going down a little bit, or vice versa. We even see sometimes, in terms of things like with anxiety, you're so anxious to go to the doctor, get your checkup, get your screenings and all that. It might cause some type of pain, it might cause some type of pain in your stomach, your pelvis, things like that, So kind of having both professionals in conjunction, I would say, is very important.
Okay, great. As you talk, the questions just keep coming. So we are actually talking about endometriosis patients, but as you spoke there, in terms of the sex, the partner may need some counseling as well.
Yeah,
because
definitely.
he may be afraid to approach because he may feel like he's going to add to the pain. So it's possible that he could benefit from some counseling as well, or maybe for counseling.
Definitely.
Yeah.
Yeah, so definitely. If you are going to counseling initially by yourself and those things do become an issue, what I would say is speak to your therapist or speak to whoever you are seeing and ask that person if they could, well, ask them what would be the best route. But in my opinion, you should start off asking them if they could facilitate a couples therapy session, and then see where you all should go from there, whether you all should continue with couples therapy and you do your own individual therapy, or the therapist thinks you need your individual therapy and your partner needs the individual therapy. Typically speaking, I know sometimes people be concerned about if I tell my therapist something, if she's going to go back and tell my partner or whoever it is. Yeah, but we are not supposed to do that. You know, my kind of rule of thumb when I have couples is if one person doesn't bring up something somebody else said, I'm not going to bring it up.
Right.
Just to kind of respect that privacy and that confidentiality, because what we speak about is supposed to be between us, you know. So yeah, I would say try to go the route of the couples therapy first. You know, sometimes partners may not always be open to it, but you know, just kind of prime them a little bit, you know, and kind of start to tell them, you know, okay, well, this is something we should do. Or even if they really just decide they don't want to do it at all, what some people do, they would kind of ask their therapist for advice or ask their therapist's opinion and go back and tell their partners. In terms of, you know, because your partner, like you gave the example, maybe scared to have intercourse. You then bring that up with your therapist, letting her know, my partner really doesn't want to come to therapy, but this is what he's saying. She could, or he could guide you in terms of how you could help your partner a little bit more understand why he's feeling how he's feeling and things like that.
As a therapist, because you know, the more I hear women talk about their troubles with endometriosis, and personally speaking, I woke up one morning and my appetite was gone, like completely, and I was just crying. But there was nothing wrong with me as far as I knew, but I never knew that endometriosis involved depression. I never knew that. Do you think it makes sense that people who have been diagnosed with endometriosis, part of their treatment, whatever the treatment is, should be some form of counseling? I mean, just talking.
Yeah.
Because it's a scary thing when you don't know what it is and this thing just falls on you.
Yeah. Yes, definitely. Because you know, that brings me a little bit back to what I was talking about, the mind-body connection, in terms of you know, we know, or we might have an idea of what's going on with our bodies, because you know, you're kind of in the process of getting a diagnosis, or you're even diagnosed by now, and then you just wake up one day and you just feeling these feelings, or you might be feeling kind of weird and you just don't know why you're feeling weird. You know, so it will be definitely beneficial to kind of have those systems in place in terms of, I suppose, medical professionals having a referral to a psychologist or something like that from the get-go, and you know, telling the person this is somebody you could contact, you know, if you do feel like you need this. I feel like that would be best case scenario. But if you know, you already are battling with your diagnosis and trying to get your treatments and all that going, you know, I think somewhere along the line, even if you don't see it in yourself, somebody else, whether it be a family member, a partner, a friend, they may say, you know, you may really need to go see somebody. And, you know, in Trinidadian society, Caribbean society, we might feel offended. We might be like, oh, but what's wrong with us?
Yes.
You know? But it is really for your good. And in terms of kind of trying to get you to be the best you could be, because now you kind of bamboozled with something else, you know, this health condition, and then you have, you know, changes in your mental health and all that going on. So at some point, I think we would have to realize we can't really do it on our own anymore, especially kind of trying to juggle so many things, mental, physical. So I would say yes, it is very important to see somebody, even if it is you find that you're not struggling with your mental health, but you're just kind of trying to come to terms with this diagnosis. The therapy doesn't have to be continuous, but it could just be a few sessions, at least to kind of help you understand that a little bit better.
Yeah, great. Thank you. I'm seeing that we have maybe one more question here. But I mean, I could ask you questions all night.
Yes.
Should someone be struggling with an anxiety attack at the point in time and persons within his or her main environment are posting constant questions and requests, what is the best form of coping skill you would recommend? I'm not sure if they are referring to questions and requests about the anxiety attack.
Yeah. Okay. So let's. Okay. So if they are talking about with the anxiety attack, then if they clarify at any point, you can just let me know, please.
Sure.
Right. So if it is about the anxiety attack, I would say, and you are actively going through an anxiety attack, I would say do what you have to do to get yourself out of that place first, out of that mental space, because that anxiety attack, if it's not controlled, it could cause or it could go on for a while. So if you already kind of know how you get yourself out of this anxiety or that place of anxiety, do what you do accordingly, and don't really entertain those questions or entertain those requests at that time. However, I would say if you are living in terms of a family setting with your partner, with your children, or if you're living with your parents, things like that, and you get this diagnosis and then you find yourself having mental health issues, even if you don't go to a psychologist or to see anybody anytime at any point, I would say you should have that conversation with your family members about, this physical thing has been affecting my mental health. And sometimes I feel this way or the other. Now, I know that, again, Trinidad we live in, and especially parents may not understand when girls tell them that, or they may just think it's an overreaction or something like that. However, I would still say it's important to have that conversation with them or attempt to have that conversation with them, because that's kind of all contributing to ending the stigma against mental health, mental illness, in Trinidad especially. But at least have that conversation with them, and best case scenario, and they are receptive to what you are saying, they could then also learn to recognize when you are probably not in the best headspace, or just recognize, you're not in the mood today, and kind of, leave you alone or help you along in any way you do need. So I hope that answers that question for that person.
Yes, and she did confirm that it was with respect to the anxiety attack. So
Yes.
that's great.
Okay.
Someone is asking if you can share some of the agencies available. I know that you've said the Trinidad and Tobago. Tell me again.
Yeah, Trinidad and Tobago Association of Psychologists.
All right. Psychologist. I'm just typing it in here so I can catch it. Is there any truth to this is an old remedy that we used to hear about when people are hyperventilating, that you breathe into this brown paper bag. Is that truth or is that a myth?
I think it is true. I think what they say is you tend to recycle the oxygen, or you just have a more concentrated form of oxygen in the bag. So that tends to help a bit more. Yeah, but some people do that and it helps them. But I think it more helps with centering yourself and concentrating yourself on your breathing, as opposed to actually breathing in the same oxygen. Because you have to hold the bag, you have to actually take deep breaths and all that. So I think that's what it would more help with, distracting your mind from whatever is going on.
Great. I'm seeing one more statement here, but before I read it. I just want to ask all the participants who are here this evening, we've shared a link in the chat. We would please like you to complete the survey. It really helps us tailor our programming to meet the needs of endometriosis patients and family members, and discuss topics that are beneficial to us and to the endometriosis cause. So if you can please fill out the survey, it takes 2 minutes, tops, no lies, right? So if you can please fill that out first, we would really appreciate it. Thank you. And so someone is saying that they attempted to have that conversation last week about anxiety and depression, and it backfired. Parents truly do not wish to understand, and that has been her experience.
Yeah. Okay, so with regard to that, I don't want you to think that they don't wish to understand. I just want you to think that, you know, that wasn't their experience, and they probably never had that experience or had to deal with it, because parents are parents. They don't have a rule book or a guidebook. They don't know what they're doing, basically. They're just trying to do the best they can with what they have. And especially in traditional Trinidadian Caribbean society, mental health was not something that was talked about probably when your parents were growing up. And because of that, they really don't know how to deal with it. So I don't want you to think they don't understand. Secondly, though, well, I don't know how old that person is, but in terms of taking care of yourself, you know, if you are having a lot of mental health challenges and all that, you need to kind of seek your best interest, especially if you try to talk to them and they weren't very receptive to that information. And thankfully, one of the good things that has come out of COVID in terms of the pandemic is that we now have teletherapy, where you just like we are here, go on Zoom with your therapist. You talk to your therapist from the comfort of your home. Your parents kind of never have to know you went anywhere. And you just go on from there, and you put your mental health first, even if you find that you can't go to therapy for whatever reason or see a therapist. Just look at things that are enjoyable to you, things that kind of get you out of that space of whether it is depression, anxiety, any type of mental illness or mental health problem you're experiencing. You know, simple things like taking a walk outside, painting, drawing. Some people enjoy crocheting, sewing, things like that. Anything that kind of just helps you deal with it a little bit more. But I would say, ideally, try and get to a therapist. That person will obviously understand you a little bit better, and they could kind of help you to process what you're feeling and what you're going through a little bit better. Yeah.
I don't want to put you on the spot, but I am wondering if there's a child that is still considered a minor, that recognizes maybe that they do have a problem related to whatever is going on with the body.
Yeah.
And the parent is, you know, giving them the brush off, but they know that they have a problem and they recognize they need help. Is there something that can be done to, I don't want to say coerce the parents, but if the child goes to the school psychologist, can the parents be made to take the child for the help?
Yeah, definitely. So in terms of, that's what I was going to say, go to the school psychologist, because then it kind of becomes the school's problem or the ministry, I think it's Ministry of Social Development problem, as opposed to a parent's problem. And hopefully in terms of whoever your school psychologist is, they are brave or willing enough to kind of take up your cause, even though your parents may be a little bit opposed to it. Because at that point, social services will kind of get involved and recognize that the child has an issue and the parents aren't attending to it. Just like if there was physical abuse or some type of neglect in the household and it was brought to the attention of the school, that's the point where we get in at now, where school psychologists are kind of advocating for their students in that same way, to help just help in whatever way they can, basically. I know obviously schools with the pandemic and stuff like that are online, but I did have a family and they told me that the teachers monitor the students, and if they see any type of neglect or any type of abuse within the household, they have to report it. So I'm not sure if the sessions are recorded to show to whoever. I'm really not sure. And I'm not sure if it's in every school, but that's my understanding of it. But that's kind of the role of school psychologists or school counselors, to protect children even from their parents, basically. Yeah.
Right. Because, the TTEA has a school education program where they talk to secondary school students about endometriosis. And I listened into one, and these girls, even the boys, they have lots of questions, and judging from the questions, you can tell that some of them have some problems.
Yes, definitely.
Maybe they're not talking to the family, or the families are not listening, but it's good to know.
Yes, definitely.
So that was our last questions, but like I said, you are pretty easy to talk to. I see why you are a counseling psychologist. I can talk to you all night. We really want to thank you, Ms. Sant, for sharing pertinent, timely information with us, and for answering all of our questions. We appreciate your expertise and your, what is the word? I feel comfortable talking to you.
Yes,
right?
That's good to hear.
So we really want to thank you for taking your time and sharing with us this evening. I'm sure I can talk on behalf of the participants who are not able to talk. They can just type questions. We want to thank you for sharing with us this evening. And I just want to remind all the participants, if you haven't done so already, to please complete the survey and look out for information from us for the next session. So I want to hand you back over to our beautiful hostess for this evening, Mrs. Kimarie Richardson. Thank you so much.
Thank you very much, Brigid. And I know it's easy to get a little confused with all the Kims who are on the platform at this time. And it's Kimberly Sant and Kimarie and so on, and I understand. And ladies and gentlemen, again, and thank you very much as well, Brigid, for taking us through our question and answer segment. It was very informative. And I know that many of you really had an opportunity to voice your concerns, air your questions, and get some clarification and answers to some very pertinent questions. We want to remind you, as we get ready to wrap up, to click the link in the chat to answer our survey. This is a very brief survey that we'd like you to access and fill out, so that it lets us know how you felt about the session and what it is we might be able to do to improve so that we can better serve you. I want to also take the opportunity to encourage you to visit our Facebook page, the Trinidad and Tobago Endometriosis Association on Facebook, and also to visit our website, which is www.endott.org, www.endott.org. And as Brigid reminded you as she was closing off, stay tuned so that you would be able to stay abreast of our next session. And we thank all of you, including our very able feature speaker, Ms. Kimberly Sant. We thank you, Ms. Sant, and we thank all of the participants for joining us once again at Spotlight Endometriosis, and we look forward to seeing you again next month. Good evening, all.